Hello, everyone. I'm Meredith Stutz. Thank you so much for joining us for another podcast conversation where we get to highlight some of the work and the people who make UC Health and today the University of Cincinnati Cancer Center so special. I am joined by two people who we will get to have a great conversation with about the world of integrative medicine, especially when it comes to the world of oncology. You'll meet them throughout this conversation and hopefully truly have something to chew on, literally and figuratively, but also potentially something to consider with your own health journey, the relationships you have with your physicians, family, and your relationship with food. So with that, I want to introduce you to the first of our guests today, which is Dr. Rekha Chaudhary. She is a professor of medicine at the University of Cincinnati College of Medicine in the Department of Hematology and Oncology with a specialty in melanoma and primary brain tumors. And she's also a faculty member in the Osher Center for Integrative Care. Dr. Chaudhary, welcome to the podcast.
Thank you.
How are you today?
Great.
Good.
I'm great.
So Dr. Chaudhary, tell us, let's just get right into this conversation.
Yeah.
Tell us, how did you become so inspired and truly driven to focus your work on integrative medicine with cancer patients here at the University of Cincinnati Cancer Center?
So that's an interesting question. It really has been a journey for me. When I was practicing in University of Toledo for about 6 years. And when I was there, I was doing lung cancer. So I'm a non-smoker. I'm not elderly. So I was okay with it. I had a little distance from the patients. When I moved to University of Cincinnati, I started doing primary brain tumors. And at that time, primary brain tumors is like glioblastoma. So glioblastoma there's no known etiology of it, cause of it. And I started to get really anxious because, with the lung cancer, it was easier, right? I don't smoke, and as long as I don't smoke, I'm fine, right? With the brain tumors, I started to get really anxious. My husband was like, you need to get out of this field. You need to do something else, And then I saw a movie, Forks Over Knives, which is on Netflix. This was, 15 years ago. And I was like, I had never been exposed to food causing cancer, okay? So cardiologists have done a great job. They're amazing, right? They've done it even as far back as the 80s. We know if you're stressed out, if you don't exercise, and if you eat steak every day, your risk of cardiovascular disease is much higher, right? Endocrinology, diabetes, we all know that, right? You eat more sugar, your diabetes gets worse. But I don't even think anybody knew that food and cancer or healthy choices in cancer can be impacted. And it's because it doesn't make intuitive sense, right? So if you're eating a bunch of fat, you can see that clogging your heart. That makes visual sense to a patient and to a physician. But like what you're eating is going to affect your melanoma on your arm. That doesn't really kind of intuitively make sense. And so I started reading about it. I started thinking about it. I used to be the kind of physician that was like, eat whatever you want, it doesn't matter. And then I saw this and I was like, there's so much scientific data that we were never taught in medical school or internal medicine residency or fellowship behind this. And so that's how I got really interested in it. And I got interested in it with my own fears of cancer. And then it just became this journey.
For you, you mentioned that word diet and food, and it's those two things together that have fueled a passion for you when it comes to the fact of the statement that we like to say here at the University of Cincinnati Cancer Center, that food can be and is medicine. Food is medicine. How so, and how does such a specific diet work in the world of cancer?
So we have to kind of go back to the history, right? So integrative medicine used to be called alternative medicine, right? Alternative medicine meaning it is an alternative to traditional medicine. So you have shots, drugs, surgery over here, and then you have alternative medicine over here. They changed the name to integrative medicine because I obviously believe in immunotherapy. I obviously believe in chemotherapy. I believe in all those things, but I also believe in joining the two. So that's how integrative medicine came about. So with the field of integrative medicine. And then diet with in that is a very controversial area of it. Most people understand that managing your stress, exercise is good for you. That's not controversial at all. Diet is, obviously, and it's controversial because cancer, again, the research was not there years ago, and now it's coming up. The interesting thing for me is the microbiome, right? So the microbiome, we live with 100 trillion microbiome cells, which are bacteria, fungi, parasites that live on our body, in our GI tract. And there's only 40 trillion cells in our body, right? And so that microbiome is the quarterback of our immune system. And our immune system is what modulates cancer. And we've only recently been learning that, right? I mean, this is a new thing. So I think that has really, the microbiome research has really been what brought oncology and integrative oncology to the forefront, because you can actually measure that in the stool. You can measure that microbiome stuff. Otherwise, a lot of physicians didn't even accept it, that a diet could modulate. Diet in the oncology world used to be like, oh, it'll make you feel better. It'll make you tolerate the chemo better. It'll help you tolerate the radiation, right? Now we're actually using it to decrease your cells cancer cells at a cellular and even genetic level, right? So,
what you were talking about decreasing cells, for those of us like me who don't have a medical degree, tell us specifically how even some foods, like talk about some foods. You've mentioned previously about the importance of whole foods.
Right.
So what do whole foods do, and what can that result in someone's cancer treatment and their outcome? Like, let's get really conversational about what happens.
So let's talk about, so we like to use animal models when we talk about this, because humans, placebo effect is very powerful, right? Like you can say, I'm eating this diet and I feel better, my cancer's better, right? So one really great example, and I don't think you've heard this example, I may bet because it's a breast cancer patient. They took breast cancer patients, they did biopsies of their breast cancer, and then they randomized them to a flaxseed muffin and a regular muffin. Okay, so the flaxseed muffin had all the bad things in it, sugar, wheat, whatever, but it had flaxseed in it. And nobody knew who was getting the flaxseed muffin and who was getting the regular muffin, because they were in a little silver foil packets. About 3 weeks later, they did the lumpectomy, where they took out the breast cancer. If you got the flaxseed muffin, your Ki-67, which is your turnover aggressiveness of your cells, went markedly down. Okay? If you got the flaxseed muffin, your ERB2, which is a measure, again, of aggressiveness of breast cancer, went markedly down. So this is just a 2 to 3 week trial of flaxseed muffins, okay? For the microbiome, they've actually done studies where they looked at patients, did they colonoscopies beforehand? I don't know how they got the approval for this, but they did colonoscopies and biopsies of beforehand, and then took South Africans in South Africa, and then at Pittsburgh, took African Americans, switched their diets. High fiber, the African Americans had to eat high fiber, low fat, and the South Africans had to eat high fat, low fiber. Wow. They really liked the diet. The South Africans really liked the diet. It was very tasty for them. But then they did colonoscopies, and they again looked at the inflammation in their cells and the bacteria, how that bacteria had changed. This was a 2-week study, maybe 2 or 3 week study, and they had changed in just 2 to 3 weeks, their microbiome and the turnover of cells and the microbiome producing anti-inflammatory things. So the South Africans had increase in their inflammation. The African Americans had much decrease in just a few weeks. So, I mean, again, it's hard for us to kind of accept that just a few weeks of change can make such a huge difference in inflammation, cell turnover, things like that. Because, people always say to me, I've been eating this way my whole life. Is it really going to change what I do in the next few weeks? And it does. It does.
To talk more about that, we wanted to bring in an actual patient who has been doing the work, making those steady changes, and even those quick, drastic changes. So we want to bring in Frank Fowler. He is a patient here at the University of Cincinnati Cancer Center, and ended up in the care and under the teaching of Dr. Chaudhry. So hello, Frank. How are you doing today?
Poor Frank.
Yeah, yeah.
So Frank, tell us briefly about your journey, that unexpected doctor's visit you had one day, and how it all ended up that you got to meet Dr. Chaudhry.
Yeah, so first of all, I'm from Cincinnati here, and my wife, Joanne, and 3 children, and we've all led a healthy lifestyle, and so I was working out and exercising and pinched a nerve in my neck, and I went and saw my primary care physician, and he said, "Yeah, you pinched a nerve," and he said, "Do you know you have a lump, a mass under your left elbow?" And I'm like, I had no idea. And he goes, "Well, let's just get it biopsied," and he goes, "I'm sure it's probably nothing, but let's." Well, unfortunately, it was more than nothing. You know, it was metastatic stage 4 melanoma, and
Sure.
yeah. So I'm good, and thanks for her and all her guidance.
We just have to ask, what was that like for you, receiving that diagnosis so unexpectedly?
Well, yeah, it's a shock. I didn't know much about immunotherapy at the time, and the groundbreaking research that is being done with it. I felt better, and then after meeting with her, I was like, oh, I'm in great care, and I knew that she is a force to be reckoned with when it comes to cancer, and I felt very good about after leaving there. And I know my wife Joanne and daughter Grace, who were with me at the time, and we walked out of there and we said, she's got this, and yeah.
And we did have it.
And we did. Yeah.
Yes.
Yeah.
Something that is so interesting about your case, Frank, is that you found out at stage 4. So for you, meeting Dr. Chaudhry, and she introduced you to this concept of care and treatment through diet. What was it like going back to those conversations? And can you give us a date, like a month, year? When did this happen?
Yeah, so my biopsy came back in March of 2023, and thankfully was able to get in and get things moving quickly, and met with her in April of 2023. And hearing her message, well, you go in there and she's got this white exam paper on the chair there, and she gets her Sharpie out and she's writing all these things down, and all my choices of how we were going to attack this, and we came up with a consensus to be very aggressive with immunotherapy, this regimen that I was able to get through. But with that, she talked about all these lifestyle changes in integrative medicine, and Joanne and Grace and I were like sponges in this meeting. And when we left there, it was like, okay, here we go. We're on a high fiber diet. We're going to manage be wary of my stress levels. We're going to get proper sleep. I've always exercised, but even exercised more. And all that integrative medicine, all those factors really enabled me to where I am today. And the high fiber diet. One of the things she mentioned in our meeting was, and many studies, but there are studies that where this diet increases 5 times your chance for immunotherapy to be successful. And I'm like, well, sign me up. And that's what I can control is my sleep and my exercise and my diet, and that's in my control. Okay. And so when she told me about the 5-fold in terms of, I was like, I'm all in. So that's all she needed to say.
You were all in. Was there any part of you that was skeptical that something so daily could be such a game changer?
No, because I trusted her, and the days of a fillet and craters and all that is probably by the wayside now, because this is my diet for life, and it's okay because thankfully both Joanne and Grace are amazing cooks, and I'm pretty finicky when it comes to vegetables, so they've made the transition much easier. So it's just the way it is, and that's I've accepted that, and it's been actually It's been good, yeah.
So by the way, for our listeners, Joanne is his wife,
Right.
Grace is his daughter, who are actually joining us. They're part of our studio audience today.
Yeah.
Hello to them.
That's why I keep looking over there.
So let's talk about that diet that you had. What did you specifically take out? What did you add?
No red meat, no pork, no alcohol. I didn't drink much, period, but gone. Processed sugar, so desserts, all those. And so really what I've done is the diet is basically from the root. Okay, so it's vegetables from the root, fruit from the vine and root, and incorporating that with high fiber, oatmeal, lentils, chickpeas, all those types of things. And that's really been the basis of that. So, you look at a plate and you look for the colors, okay? And the more colors you have, the better that is. And so, we've been focusing on the high fiber, and I have a fiber tracker as well, an app. And so you try to get 30 grams a day of fiber, and so either
It's hard.
It's hard.
Yeah, if you're not used to it.
If
it's
you're not
difficult.
used to it, but once you get used to it, then it's okay. And actually, a lot of times you blow right by the 30
Right,
grams by
right.
lunch.
Yeah.
For you, you made these changes. How long did you make these changes to see results, and what were those results that you got?
Well, the changes went into effect right away. And so this regimen that I was on, we had 4 rounds of this cocktail, as I call it. And so I knew something was working, that I had an MRI, an abdomen MRI, and the results came back, and these lymph nodes in my chest cavity were either gone,
Yeah,
okay,
I don't
and
remember
then
that, yeah.
one was reduced.
Yeah.
And I knew that this was working.
Right.
And so then after my 4th round of this cocktail, I just knew that that when we did the PET scan, that it was going to be a good result, and I'm in what they call complete response, and which is just amazing, and that has been since August of 23.
23, yeah.
And if you're listening right now, Frank has a huge smile on his face.
Yeah.
A
Yay.
wonderful
Yes,
smile.
yeah.
Joanne is raising the roof.
Yeah.
Yeah.
Now, I have to ask you, Dr. Chaudhry, going back to that diet, why did you give him that diet?
Yeah. So let's be very clear before. Frank was on the most intensive immunotherapy we have.
He
right?
was stage 4.
Yeah, he was stage 4, and we discussed the side effects and risks, and he decided he wanted to be the most aggressive. So we we have varying levels of aggressiveness with immunotherapy, and we picked the most aggressive immunotherapy. He was actually on a clinical trial to begin with, right? That was very, very aggressive. So the immunotherapy worked too. So again, integrative oncology, right, where the immunotherapy is doing its work as well as the diet. So actually published in Science in 2021, maybe, there was a study where they actually looked at patients that had a high fiber diet and got immunotherapy. And the patients that had a high fiber diet, now this is a retrospective study, so this is going back and looking. This is not prospective, going forward and looking. The patients that had a high fiber diet and also were on immunotherapy had a significant progression-free survival benefit of their melanoma, okay? So we know that for a fact. Again, that's retrospective. There's an ongoing prospective study looking at that. And how does that work? See, again, it's not intuitive, right? Like you're like, what? I don't understand. You're gonna eat this fiber and then my melanoma underneath my arm is gonna go away. Like it's just not intuitive. And how it works is when you're eating diverse fiber that's whole foods, like he said, from the root, from the tree, not, potato chips, right? Which are processed, they don't grow on trees. Potato chips don't grow on trees. So when you're eating that kind of diet, that's what feeds your bacteria. So if you eat a potato chip and chew it up, Your bacteria don't get a lot out of that. If you eat a potato, sweet potato, purple potato, white potato even, the fiber, your bacteria love that. That's their food. So they chomp on that, and then they produce anti-inflammation. They direct your immune system, which is already turned on from the immunotherapy, to attack. So it's another way to heighten your immune system to attack the cancer. Our immune system in our body, all of our bodies here, is constantly surveilling for cancer. We're constantly looking, and our bacteria really direct that. So if you have diverse bacteria, if you have lots of different kinds of bacteria, and how do you get diversity in your bacteria? Eating lots of different whole foods. If you're drinking juice, the fiber's gone from the juice. So if you're juicing, the fiber's gone, the bacteria that just goes right through you, right? So feeding our bacteria, specifically for melanoma, and other cancers as well, but there's most of the research has been done in melanoma, seems to be a huge benefit in increasing the diversity. So you have all different kinds of bacteria. It's not important to have strong bacteria. It's to have different kinds of bacteria that are going to direct your immune system like, go this way, go this way. I know, it seems like science fiction, right? And that's why it's so hard for people to kind of accept it, right? But these studies are published, they're done in mice, they're done in humans, they're published in journals. There's a study at the National Cancer Institute where they're giving fecal transplants. So they're giving patients who are responding to melanoma, their melanoma treatment, they take their stool and they give it to patients who are not responding, and then they have a response. It's just amazing.
So, hearing all this
stool
science,
talk.
True.
Yeah.
But for Frank, you took a gamble on this and you said, I'm all in.
Right.
And remind us again the results that you had, not only the label that you now proudly wear, but tell us what happened to your cancer.
So, and just to piggyback off of the diet that I'm on, I will say that for your heart health and brain health and overall, it's a fabulous diet to be on. So not only for cancer, it's great. So I know that in this journey that I was on, that the immunotherapy, and she is correct, I guess maybe because of where the lymph nodes were, not my organs, my physical health, we attacked this and went after this aggressively. And some days were easier than others. But I thought it was a piece of cake for a while. But then I just be careful what I wish for, right?
Yes.
Yeah.
That's what I told you.
That's right. And so there were some side effects toward the end that were tough. So in that journey, you want your immune system to have side effects, which means it shows your immune system is in overdrive and it's working. And so I knew initially that, especially in the beginning, if you get side effects right away, then that's a great sign. And I did. I had skin rashes, and which is one of the
I'm laughing because immunotherapy, when you have toxicity or side effects, the worse the side effects, the better the response. Okay, because that means your immune system's really turned on. Your policemen in your body, I call it the immune system policemen. Your policemen are really turned on and they're fighting all this cancer. So it's opposite of chemotherapy. Chemotherapy, you don't want side effects. But immunotherapy, you want some side effects. Mm-hmm. So he'd always come in and be like, I'm not having any side effects. I'm like, you're going to be okay. Be careful what you wish for. That's why we're laughing.
And it did. It hit me like a ton of bricks on the fourth round of that. So,
But then he's doing great. We made it.
Yeah.
But to help our listeners understand, what happened to your cancer? Did it slow down? Did it?
It went away. He's gone. So his most recent PET scan, it's been gone since August of 2023 on the PET scans.
Right.
That's remarkable.
It
is gone.
So,
and Frank, I want to hear from you because this is your body, your life.
Yeah.
It's gone. What do you think? How are you feeling?
It's amazing, and I will tell you that you don't take this. You take every day, and you don't take it for granted. That's the truth. And so I know that I have 4 more years. Actually, I just asked you recently, how much longer do I have to do these? But I have PET scans and MRIs and blood work for the next 4 years. But thankfully, everything is perfectly clear. And so just you can't describe the relief that when I walked into her office and she said, "You're in CR." I'm like, "Well, what's CR?" And she said, "Complete response," which is the best you can have. And that, yeah, and so I have no cancer in me.
Right. That's visible.
That's visible, right?
Yeah.
For now.
For now. And I think it's going to stay that way.
Right.
I mean, I do. Because we turned on his policemen. Okay, these policemen are out there fighting cancer. We turned them on, and he continues to turn them on with his diet, right? He continues to make his policemen the strongest policemen that are out there, or the strongest immune system that are out there, looking at that one cancer cell tries to come back, and hopefully your policeman, your immune system is so trained, and you've got these great bacteria, telling them where to go, it won't be a problem.
Right.
Yeah.
Frank has talked about the gratitude, the relief and celebration. Would that be how you view life now?
Oh yeah. I mean, you asked a question earlier about that initial diagnosis and how and after I got through that, you could be angry that you have this, you could be afraid, anxious, and in a very short order, because of my faith and family and friends and my coworkers in my company, Imperial Dade, the acts of kindness that through this whole journey has been overwhelming. And my main mindset through this whole thing has been gratitude. Not angry, not afraid. It's gratitude and gratitude for, oh my gosh, from day one of finding this out and being put into her path. And I mean, I'm eternally grateful for her for that. So it's been overwhelming, the gratitude journey, for sure.
What about you for Dr. Chaudhry? Dr. Chaudhry, what has it been like for you to see these results happen for Frank?
Well, metastatic melanoma, stage 4 melanoma, used to be, 10 years ago, 15 years ago, it used to be like, there's not a lot we can do, right? And now, because of science and because of immunotherapy and, the information we're giving patients, try to limit antibiotics, try to do this, try to do your diet, try to be aggressive to a point, we're seeing these responses like that. Because, when people see me, they ask me with stage 4 cancer, how much longer is this going to make me live? They ask me that. They're like, oh, is it going to be a few months, a few years? And I tell them, and I tell medical students this, and residents this, and fellows this, we're not talking about lengthening your life. We're talking about making this go away forever. So your question should really be, what is my chance of this going away forever? What is my chance of, as oncologists, we don't like to use this word, but cure. What is my chance of cure? That's not the right question. The question is not, are we going to make you live a little longer? The question is, what is our chance of cure? And so we're really curing, again, oncology, we don't like to use that word, but we're really curing metastatic melanoma. So it's been,
Say that again.
I asked her that question in that initial meeting. I said, what do you think my chances are? And that was the other thing. She said, I think your chances are excellent.
Yeah. And
those were words that I walked out there and I'm like, we do have this.
Right.
And that was exactly what you're talking about, the questions that you do ask.
Yeah.
And that's all I needed to hear was that my chances were excellent.
And to his credit, not a lot of patients take the bull by the horns, right? So he really did. He, I'm going to do this diet, I'm going to do this exercise, I'm going to try to manage my stress, I'm working with meditation, with Barbara Walker through integrative health, and doing all these things. I mean, he really took the bull by the horns. And, there's data to show that optimists live longer with cancer, right? Because they are making these changes in their life. They are, having more control. When you have a diagnosis of cancer, everything happens to you. you're driving you're going about your life, putting the key in the thing, driving around, going to work, doing all these things. You're very independent. And then all of a sudden you have cancer and all these things are happening to you. You're getting radiation to you. You're getting surgery to you. You're getting immunotherapy to you. You don't have much choice. You just sit there and take it, right? So when patients feel like they have a role in their cancer remission journey or their cancer treatment journey, where they are taking charge at home, they're getting better sleep, they are managing their stress, they're exercising. I mean, he was already exercising a lot, but a lot of patients are not, and then changing their diet. When you have patients that do that, you see better outcomes because they feel like, again, you mentioned the word control too, and they feel like they are also doing something. I'm prescribing the immunotherapy, you're doing the diet part. We're working as an integrative team, not an alternative team, right?
Correct, yes.
Something that we're hearing you say, Dr. Chaudhry, is this concept of integrative medicine as it's another, we're talking about the different F's. We have food, family, friends, faith, and also fight.
Yeah.
So when it comes to integrative medicine, this concept of whole person care,
Yeah.
why is it so important that someone like me, our listeners, even the folks here at the table today, take so seriously this concept of food as a way to fight?
Yeah. I said we all have cancer cells floating around in our body, right? We all do all the time. And our immune system is fighting them all the time. So again, people use food. The ancient integrative medicine used to be, I'm so tired, I want to use food to make me better, feel better. I want to use exercise to make me feel better. Yes, quality of life is important. But when I tell you that food has changes, not only at the cell level, the bacteria cell level or the cancer cell level, this is actually changing your genetics, changing the expression of your genes. So you know that the risk of breast cancer in Japan is exquisitely low, exquisitely low. But when women come to the United States with the same genes, then Japanese Americans have the same breast cancer risk as Americans, women. Why? What happened? Their genetics didn't change, right? They're the same people. So I think it's the expression of those genes. So we all have cancer genes in our body. How do we express them? And that's called epigenetic science. So, do we have promoter that we turn on? So if you eat a blueberry, this is not what I'm intending. I'm just making it very simple. You eat a blueberry, it turns off your cancer promoter gene. You eat, some very processed, nitrated sausage, and it turns on that cancer gene. So we can even affect our genetic expression, right? Our genetic expression. So, this is separate from the microbiome. This microbiome is a whole other thing, and then the epigenetic expression of our things is a whole separate area of science. So I think that, what was your question again? The integration. I forgot the question. I started talking.
Just how important is this concept of food?
Yeah.
To fight?
So for Frank, it's obviously very important.
Yeah.
But he grasped on this when he had cancer. We all need to be doing this to prevent cancer, right? And I'm in a place where I see cancer all the time. So that's why I'm so passionate about this. But a lot of us who are not involved in the cancer world, we go about our business and we do our things, and we don't think about cancer or heart disease or dementia or strokes, or we don't think about those things because we don't, in our normal everyday life, see people with that. And it shouldn't be fear that drives this change, right? It shouldn't be fear. Like I told you the story in the beginning, it was fear that was driving that change, right? Because I was so scared, I'm gonna get this cancer. Now, I think we literally need to change our definition of luxury, okay? So luxury used to be, you'd have a steak, go to a steakhouse, have a steak, have a fine Bordeaux bottle of wine, mashed potatoes with cream and, cream and butter and all that. That used to be luxury, right? That used to be our definition of luxury. You can go to any steakhouse in Cincinnati and get a steak today. Do you know how hard it is to find a plant-based, low-fat, whole food? That is luxury now. That is luxury, what you can't get.
How hard is that, Frank?
It is hard.
It is,
Yeah.
to go out to eat.
Oh my gosh.
Yeah.
And especially if you're traveling,
Yes.
good luck with that.
Yes.
And so it's hard. We have identified some restaurants that are alternatives that you can and find those, but the days of the steak and then and don't forget the dessert.
Right.
The carrot
That's
cake or
our
whatever.
definition of luxury, right?
That's gone.
And that we've been marketed that, right? That's been marketed to us. That you sell on your birthday, where do you go? You go to a steakhouse and you have a piece of cake and things like that. But I think that's all changing our mentality of luxuries, being able to exercise when you want, the freedom to exercise when you want, the freedom to meditate, the freedom to be safe, the freedom to have whole foods that are not processed.
Frank, what is your diet now?
So my diet, typical morning will be a banana with some yogurt or oatmeal. Joanne made a great blueberry oatmeal kind of casserole that I have. That I have for that, and so that's normally that. And then for lunch, so I'll have. I pack all. I never go out to eat. I pack all the time, and it's. I'll have a small bag of like nuts, okay, more fruit, more colored, blueberries, strawberries, raspberries, and then I'll have some like a chickpea pasta with that, and that's normally for lunch. And then for dinner, they're again very creative with the types of meals we have. A lot of seafood, a lot of fish. So basically, it's a vegetarian diet with high fiber, with and I do incorporate seafood. I have to have that.
So Frank, this has been your journey for now more than a year.
Mm-hmm.
Why did you want to share your story with us today?
Well, if you had an hour, I could go over everything. But it's really about gratitude for all the professionals at UC Health, okay, and especially Dr. Chaudhry and her team. They're just amazing. They really are. And I wanted to get the message out to, I never want people to go down my path, but I know that's not realistic. I just know that's, but if knowledge is power, and if people know that if they are going down this path, that integrative medicine, and specifically a high fiber diet, incorporated in all of that, is really going to improve their chance for success. And when I had that meeting with Dr. Chaudhry, my first initial meeting, when we left, and again felt good about everything, I kind of remember the UC Health tagline: "In science lives hope," and that's exactly what she gave me. And I'll be eternally grateful for that.
Dr. Chaudhry, that line, "In science lives hope."
Mm-hmm.
We certainly see it, and we try to live it out every day here at UC Health and the University of Cincinnati Cancer Center.
Right.
So how does working here at the University of Cincinnati Cancer Center, working with the Osher Center, give you the chance to give more people like Frank hope?
I really love that tagline. I think that's a great thing for a university, right? I think that there is an emphasis. We have a tripartite mission: patient care, research, and education. And the research part is important, right? Because that's what separates us from other places in the city and in the tri-state, right? So whenever I talk about integrative oncology, I always talk about it, and I may be too sciencey for you today. You might be like, we got to cut all this out, right? But I always talk about it from a scientific perspective, because I think that sometimes people are like, well, I'm going to take this coffee enema, for instance, and that's going to be, but the science doesn't support that. And I think it's very, very important when we go forward with integrative oncology and integrative medicine in general, that we go forward with science, okay? We don't have the funding the pharmaceuticals do, but I think eventually we will. We will eventually have people who are interested enough in this to fund it. and the research and to really do scientific work. And I think that's what separates us, and that's what's great about UC, because we're doing integrative oncology from a scientific perspective. And that's really important, right? I think it's really important. And I mean, you may disagree with me, but I think what convinced you was I told you, here's the science, here's the stuff. And then he's like, oh, if I would have just said, cut out the red meat, eat a high fiber diet, I mean, I think you would have been like, okay, whatever, And I think that the high fiber thing that he keeps pointing out, that just makes your plate, shifts your plate to whole food plant-based, right? Because where is fiber in whole food plant-based foods?
As we're finishing up our conversation here, Frank, I'll let you have the last word, but Dr. Chaudhry, what would be your advice to someone who is listening? They've spent time in this conversation today, and maybe you're thinking, what can I do, even today, whether I have a cancer diagnosis or I'm living with someone with a cancer diagnosis, what is something that I can do today to take a healthier step for prevention or in the world of fighting?
Yeah. So we are so fortunate here at University of Cincinnati to be one of the 11 centers in the world as the Osher Center for Integrative Health and Care. And so we have a lot of great resources. So if you're a cancer patient or someone with cancer, or you have a high risk genetic profile and you're trying to prevent cancer, you can meet with a physician to go over lifestyle changes. Dr. Golubich is wonderful. He used to be at Cleveland Clinic and now he's our head of our lifestyle medicine. We have acupuncture, we have massage, we have Tai Chi, we have yoga, we have dietitians, we're building a teaching kitchen. I mean, we have so many resources for the greater Cincinnati community that are available to them to talk about this other aspect of the cancer fight. Of course, you're going to meet with your oncologist, you're going to meet with your radiation oncologist, you're going to meet with your surgeon. But this is really the part of your fight. That's not the cancer fight. That they're going to be fighting for you, Just really taking, again, the bull by the horns and just saying, I'm going to do this. I'm going to do this. And it takes information. You just can't go on YouTube or Instagram or anything like that. You really need valid medical scientific information. I've had patients spend thousands and thousands of dollars on supplements and other things like that. And I think it's really important to meet with a physician who specializes in this. And because we're part of the Osher Center and because we have so much science here and so many resources, I think we're really lucky to be in Cincinnati today.
And Frank, as Dr. Chaudhry was talking about that fight, there's this common phrase of like, oh, those are fighting words.
Yeah.
So what would you say to people as our last thought on today's conversation? What would be your fighting words? Words of encouragement, that halftime speech to someone like you who might have just gotten a diagnosis, maybe having an appointment this week as they're listening.
Yeah.
What fighting words would you give them?
Well, it's we've all seen Coach Valvano in his "Don't Give Up, Don't Ever Give Up," and I would watch his speech and the V Foundation, and boy, those are words that after now me going through that, don't ever give up. And take advantage of all that's offered beside this incredible lady next to me. And
I just do
and
melanoma.
But Dr. Cotton.
But we have breast cancer specialists. We have other cancer specialists.
They do, and that's right. And Dr. Cotton and her team, I mean,
they're amazing.
Barbara Walker, I mean, she mentally has helped me through this journey. And I mean, just everyone. And through the Osher Center, and I would highly recommend it. Everyone go to their website and see that's all that's offered for someone that either preventative or, unfortunately, in my situation. But I just want to give encouragement to anyone don't ever give up and just stay the fight and take advantage of all that's offered to you.
Thank you both for this conversation. It's been an honor to sit at the table with you, even getting to spend some time with Frank's family, who he now joyfully is sitting with a year later. What a point of celebration and gratitude that is. So thank you both for your experience, for your medical experience, and y'all teaming up together to give us a little bit more hope and a little bit more insight on the power of science and the power of food when joined together. So I'm Meredith Stutz. Thank you so much for joining us on this conversation today, and we look forward to you joining in our next conversation in the near future. Have a great day.